Good morning, everyone. Today, I'd like to discuss an intriguing and complex clinical case highlighted in a report by Hirata et al. 2022. A floating mural thrombus in the ascending aorta can cause multiorgan infarction. Introduction. This case involves a floating mural thrombus in the ascending aorta, a rare but critical condition that can lead to multiorgan infarction if not promptly recognized and managed. The chief complaint, while not explicitly mentioned in the report, can be inferred from the patient presentation. The patient can come to the hospital with some upset left side subcostal pain. The symptoms was suggestive of a severe underlying condition, leading for the further investigation. History of present lines. The patient's current alliance history showed that they initially had symptoms suggestive of multiorgan infarction. The onset of sudden pains under the left ribs led to the diagnosis of a splenic infection, which prompted further imaging tests. A thoracoabdominal CT scan revealed mural thrombi in both the ascending and abdominal aorta, raising concerns about aortic dissection and other severe complications. Review systems, ROSE. Although the detailed review of systems was not explicitly recurrent, it can be assumed that a thorough ROSE was performed due to the complexity of the patient condition. This probably involved evaluation systems across multi-organ systems to gauge the extent of the infection and inform of the diagnostic process. Past medical history. The report did not include specific details about the patient's past medical history. However, it is evident that a comprehensive evaluation was essential to identify any pre-existing condition or risk factor that might have contributed to the development of the floating mural thrombus and the subsequent multiorgan infection. Personal and social history. The patient's personal and social history revealed that they were a smoker with a Brickman index of 495. This detail is significant as smoking is a known risk factor for thrombotic events and vascular disease, which likely contribute to the patient condition. Family history. The report did not explicitly mention details about the parents' family history. However, understating family history is crucial for assessing the risk of cardiovascular and thrombotic disorder, which might have been relevant in this case. Physical exams, labs, other tests. Now have the following tests performed for the patient: continuous electrocardiographic and transthoracic echocardiography (TTE). These are the results. To identify the source of this emboli, trasoesophageal echocardiography was performed. This diagnostic test revealed a floating aorta mural thrombus in an ascending aorta, a rare but dangerous condition that can lead to widespread organ damage due to embolic events. I will show an image of what they found. Assignment a plan. Presentation: splenic infection and mural thrombus in the thoracoabdominal aorta suggesting aorta dissection. Renal, mesenteric, and cerebral infection indicating a high embolic load. Plan: initiate anticoagulation therapy after renal and mesenteric infection. Surgery remodeler of the floating aortic mural thrombus. Post-operative treatment with a warfarin, a beta blocker, and stenting. Ongoing monitoring to prevent recurrence of infection and manage cardiovascular risk factor. Finally, here are my references. Thank you very much for your attention and have a nice day.